Yeah, and I think we'll take time and put together that.
Yeah, it's gonna be interesting. I feel like it's sort of comes on. People are getting to. Like you just provide. Actually, yeah. Wonderful. My PhD. I'll be very different. Be happy.
He's not just guy.
We get to do a lot of research.
No, I just. They were asking me, like, this is how we need it. So, well, I give them the email. But like, I did this. I didn't know. I don't have a most of the.
I asked my son. As I'm like connected to the trainer.
You're saying like more.
Bond and six.
What?
I needed to pass, get it to college.
I'm just like, wait, when you get ready, I'm like, well, yeah, the one thing. Is you help with basically look. Because my life is but it depends on the time.
Show my solidarity.
This is good.
Learn something about little.
So I mean, people think that.
Was presenting credit.
And then.
They were planning to go get. That's guidance from Alia last night.
So she's excited.
That they don't necessarily want to budget. Actually now, they just don't have it. Plan it, but then you're like, no. We can actually. Tomorrow this.
I say no here. I was trying to be like.
Hey, Karen.
Did they found that?
Yeah.
Yeah, I can't see the. It says recording. on it.
Yeah, so,
Basically.
okay,
Do you
yeah,
think they've come to do it? 'Cause
yeah, I guess. So. She said it's up here.
There's no more like start webinar button.
So I guess they did it for you.
Thanks for your help. So where is it?
Already started?
It's fine if it is, but. Good morning. I like how everyone sat here. Only two very brave people sat there. Are we can get started, or should I wait for them?
No, they already started and
Okay.
the recording they're supposed to take.
Okay, so I'm great.
I will just make sure the. Yeah, okay, I think.
Okay. Good morning, everyone, and welcome to the very last day of the conference. I applaud you for being here. I know it's it's the fifth day and yeah, we're probably exhausted with all the interactions, but thank you very much for coming to our session on innovations for financial and water safety management in the rural water sector. My name is Caroline Dallaire. I work with Acquia. And together with colleagues from International Lifeline Fund, IRC, and Water4, we want to talk about innovation. So innovation is one of the SDG accelerators. If we want to achieve universal coverage or make progress towards that, we have to innovate. The rural water sector is not the simplest sector to innovate in. It's a very challenging sector. What we want to demonstrate today is that despite this, the rural water sector is vibrant with new ideas and innovations. But innovation is not easy. Oftentimes we struggle, we face challenges, sometimes we fail. The goal of today's session is to present the reality of innovation. We want to be transparent about what's hard, what's not working, and to have a discussion about that. So really, we have organized today's session to promote transparency about what is difficult. We are going to start with 6 quick presentations, like 4 to 5 minutes each, to present a broad array of innovative approaches. We'll have then 15 minutes of questions from the audience. And please challenge us to ask us about what's difficult, where it's failing, because that's what we want to be talking about. Then we'll have a little quiz, and then we'll break out into 3 groups where we're hoping to discuss with you, again, dig deep into the difficulties, the struggles, the failures, and also hear from you. So with that, we're going to start the presentations, and welcome to our online audience as well. So I would like to invite Lars Osterwalder from IRC. Yeah, thanks.
Thanks a lot, and good morning, everyone. So one innovation that IRC is presenting today is about district WASH master planning. Yeah, which is about the development and implementation of long-term climate resilient plans at district level to achieve sustainable water, sanitation, and hygiene services for all forever. So what's the problem? Yeah, also at district level, there may be plans, certain plans, short, medium term, annual plans, but they often lack a long-term perspective and strategy, and they're not realistically costed how and don't have a clear vision on how to reach there, how to achieve national targets or how to reach SDG 6. To address that, or what IRC is doing to address this challenge, is we support the development of costed, longer term, 5 to 10 years strategic plans to achieve long-term visions at the district level. So it's based on assessment of the current situation. What is there? Then where do district stakeholders want to go? What do they want to see in 5 to 10 years time? Yeah, what is the plans to get there? What needs to be done? And then to cost, how much does it cost to do that? Then a validation, like stakeholders need to be involved, need to be aware about the plans, so they will be signed off. And then everything is about implementation, then translated into midterm plans and annual work plans. Very important, what I want to mention here is the plans and the process needs to be owned by the government. And we want the district stakeholders to own the plan, to be there, to understand what is there, where they want to go, and how they want to reach there. So over the past 6 years, IRC has worked in 26 districts in 6 countries. That's almost 4 million people living in those districts. We found that having evidence-based, more realistic plans actually helps attracting finance. So you'll hear me afterwards also saying it's a challenge. So it's basically both. I mean, it supports getting finance, but not in all cases. But overall, we believe that's what is needed for districts to get more funding. And it overall helps to strengthen the systems that are needed to deliver sustainable services. One more point is about the life cycle costs that are very important to understand, not only the cost of the assets, but understanding the operational costs, the direct support, indirect support costs that are needed over time to support the district. But now, moving into the challenges, I was asked to not stop at that slide. We just put together, I'm with IRC Ethiopia. So I put in 3 districts that we have in Amhara region in Ethiopia and some challenges that are applying for those districts, not necessarily for the other 23. Attracting finance, as mentioned before, here we found that only 20 to 25% of the required finance that was planned for could be identified, could be sourced and invested over the past years. We're also struggling with high turnover of staff, not project staff, but staff working at the government district offices and the decision makers. And as institutions are relatively weak, ownership is often with individuals and not necessarily with the institution. So as people move, people are not aware anymore that we have a district plan in a worst case, or like the ownership kind of comes and goes and is a big barrier to really get full government ownership. Capacity is an issue throughout the process that needs to be addressed. And the last point I found very interesting by talking to our representative of IRC in Bahir Dar in the region. So he said, actually, the integration of the regional government wasn't good enough. So we work at the national level, we work at the district level. In between, we have the regions. And the regions, they look at all their Waredas and they see, okay, in those 3 districts, there is IRC and consortium partners working. So no more finance should go there. There's NGOs, they're taking care of that. So we actually found that it limited certain funding to come. We have the nice plans, but the government kind of thinks, okay, there is an NGO, they will take care of that, and are not really willing to allocate additional funding. So just a few examples for those 3 districts and challenges, and hope to discuss more about that later on. Thanks a lot.
Thank you, Lars. Next, I would like to invite Mickey to the floor, Mickey Jones. Take it away.
Hello, welcome. It's good to see that there are people still here on Friday besides us. So my name is Mickey Johns. I work for International Lifeline Fund. We work in both the clean energy and the WASH sector. Obviously, I'm going to focus on the WASH sector because this is a WASH conference. Within our WASH, we work in northern Uganda in 3 districts. We do new drills, rehabs, and then we also have a social enterprise called Everflow, which is what I'll be discussing today. So problem, borehole functionality. I'm sure we all know it's a problem. It's a problem a lot of people are trying to address. How do we keep the infrastructure we have operational? How do we get out of this build, neglect, rehabilitate cycle? And I'm sure many of you have also seen the graph from the World Bank from 2016, where O&M is set to outpace, at least in 2016, it was set to outpace in 2025, O&M versus new infrastructure. So how do we make sure things stay operational? So at International Lifeline Fund, we started a social enterprise for preventative maintenance called Everflow Africa. So this was founded 5 years ago in 2017. Communities pay a $25 monthly subscription fee. And within that fee, they receive a monthly routine maintenance check by certified hand pump mechanics. And then they receive an annual overhaul. So that all the pipes get taken out, everything gets inspected once a year, and worn parts are replaced by certified quality spare parts. Then we guarantee there's a response to any breakdown within 24 hours. And there's also a toll-free helpline that communities can call to report the breakdown. So it's they don't have to call us, they don't have any credit on their phone, they can still call us and report a breakdown. So we'll start with the good news first, the impact. So Stanford did a study in 2019 and 2020 of our social enterprise, and they found that it does have a huge improvements in uptime for subscribed communities and also high customer satisfaction. So we have achieved in the boreholes that we have preventative maintenance, 99% or higher uptime. So this means 12,500 people have had continuous access to reliable water. That just means that, they don't have to go to the nearby borehole. They don't have to go back, revert back to the dirty area that they used to collect water. And then Stanford also estimated there's about 30% savings in cost versus the neglect and rehabilitate cycle. Fun part, the challenges. So there is low demand. The low demand is obviously due to a variety of reasons. Some of it is cost, which I'll get a bit more into in the inconsistent payments. But what we've also found is during election cycles, politicians will come around and tell communities that we'll pay for your rehab. You shouldn't have to pay it. We'll pay for it. They rehab it once, get elected, don't rehab it again. So it falls back into the neglect repair cycle. Also, people aren't, it's hard to explain preventative maintenance. If something's working, people don't want to pay for it. So they're unsure why they keep paying the subscription for their borehole working. The borehole's working because they have preventative maintenance and because they have someone coming and checking and making sure that they have continuous access. There's also inconsistent payments. As I mentioned, it's monthly payments, but as we all know, rural communities have a seasonal income based on the agriculture rainy season. Also, monthly payments is not a typical thing in rural communities. They don't have a monthly phone bill, a monthly rent, mortgage, anything like that. So monthly payments is still a very new concept. We've also found that the payments we do receive at the price, they don't actually cover the cost of our operations. So some of the stuff that you don't think about in our operation is marketing. How do you tell these communities that there's this product available? You have to go out to the communities and market to them. You also have to visit communities. You still do that monthly maintenance check. If nothing's wrong, we still use that fuel, that time, that personnel cost to check the borehole. And then one of the things we found that we've addressed is we also found early on communities were subscribing after their repairs cost more than their initial subscription. The initial subscription is 3 months upfront. So as soon as their repair costs more than that, they called us up and say, we want to subscribe. They get their borehole fixed for cheaper than they would have otherwise by very qualified people, and then don't pay again. So the way we've addressed that directly is when someone wants to subscribe, we do a check on their borehole and if that cost is more than the subscription, they need to pay the cost for the payment, and that's their subscription cost. Excuse me, they have to pay for the cost of the repair, and then that's the subscription cost. So I'm going to talk about our next steps, what we're doing to try to address this, because obviously when we see challenges, we want to try and figure out how to address them. So one of the things we're looking at is offering a tiered service rather than a one. Right now, we only have that one offering of the $25 a month. So we're looking at trying to meet customers where they are a bit more. So trying to lower us, raise them up, and kind of meet in the middle. So with that tiered offering, that'd be a yearly versus a monthly subscription fee. They would still get the quick response and the toll-free helpline. And they would also still receive an annual overhaul, but they would have to pay for the service. If it breaks down in the year, they'd have to pay. It would be a reduced cost versus if they weren't subscribed, but they would still have to pay for the spare parts and the labor to fix their borehole. Another thing we're piloting is smart hand pump sensors. You can see the woman, there's a sensor right there. It can be remotely monitored. So the goal with these smart hand pumps is to be able to predict failure before it happens. So then the mechanics are going out only when it looks like failure is about to happen. So they do the preventative maintenance right then, rather than having to go out monthly or every other month. And then drip irrigation. We're currently piloting drip irrigation in, I believe, 4 communities right now. And what happens is we give them drip irrigation equipment. They do pay us back for that, but also they pay for the Everflow subscription with the income they receive from gardening. So it's when they can garden during the dry season, so they can sell these vegetables for much more expensive on the market. And that means that they can receive an income, and then they can basically sweat equity, but we get money for the sweat equity. Some other things we're looking at is performance-based financing. So that's like uptime, carbon financing, VSLAs, which another presenter will be talking about later, and then collection of payment via a mobile app, because then also you don't have to travel to go collect the monthly payment. So thank you all very much. Back to you.
Thank you. So now I'm going to present work that my colleagues Catherine Marshall and Alan Mutegeki, based in Uganda, have done over the past 2 years. So this is about using village savings groups to unlock community payments for water. So we've heard Miki say demand is low, people don't want to pay monthly. Is there an innovative way to address that? Sorry. So in rural Uganda, consumers rarely pay for water regularly. Paying, either every month or every time you fetch water is very uncommon. As a result, there is no money to pay for repairs, and there is a very high rate of hand pump breakdowns. One solution that we piloted, we were inspired by other NGOs doing that in Uganda, is to embed water user fees in village savings groups. So village savings groups have very strong accountability mechanisms. They are perceived as being very transparent and trustworthy. And so we felt that perhaps they were a suitable group to collect user payments. One of the biggest issue currently is that the water user committees that are in charge of water points and collecting fees are often viewed as corrupt, and people are reluctant to pay water fees because they believe that the money is going to disappear. A village savings group is the exact opposite of that. It has a lot of trust. The people put their savings into this group. So there are a lot of mechanisms for accountability. And so perhaps this is a better group to collect water user fees. So the way this works, members of the village savings group meet weekly or every 2 weeks, as they usually do, and their main activity is to put their savings together, take loans, give loans to each other. So that's their main activity. But every time they deposit some money into their savings account, a small percentage goes into a water fund. A water fund is a separate account. So when I say account, it means like a box with a lock. And that money is ring fenced for water. It cannot be given out as loans. It has to stay there for water point maintenance. And that system is written in the Village Savings Group constitution, and all members have agreed to it. So at the end of the annual cycle, we hope that the money in the water fund has increased and that there is now sufficient money for water point maintenance. So this was successful in the 10 communities where we piloted this, to the point that the local government decided to replicate and expand this approach on their own. The black line on the graph is, so you're seeing every month for a 1-year period. The black line is the amount that you typically need in Uganda to maintain your hand pump. It's about $80 per month. And the blue line is the average amount that these village savings groups manage to accumulate in water funds. So they manage to accumulate more than what is needed for O&M. And this was a huge progress, because they went from having no money for O&M to having more than enough money for annual maintenance. So the challenges. So the problem, if you have money sitting in a rural community, if it doesn't get spent, it's going to disappear. You cannot have idle funds in a village savings groups. It's going to get loaned out eventually. And so it's really hard to do that, to spend the money when there is no professional service provider. Where we work, Everflow is not yet providing services. It's the regular Hand Pump Mechanic Association, which is in this case, a very loose, informal, disorganized group. And so the communities are now asking how they can spend that money. There is no preventative maintenance scheme, for example. So that's a challenge. Once you have the system set up to collect water user fees, you need a way to spend that money. Otherwise, it's going to be loaned out. And another challenge that we observe is that not all water users join the village savings groups. They can decide to opt out. So it's a small fraction. I want to say maybe 20% of water users decide not to join the group. But over time, we believe this can cause friction because people in the group will say, well, I'm paying every week a very small percentage of my savings. What about the other ones? They're using the water as well. So addressing that in the long term will be interesting. That's it. Thank you. Oh no. What happened? Welcome, Philip.
Thank you so much. Good morning, everybody. Hope you're doing well. Today, I'm going to be talking about kind of expanding upon our topics that we've been going through for Water4. Water4 is a company that serves 15 different enterprises in 9 different countries across sub-Saharan Africa. That's given us lots of different experiences to say, what are the challenges with financial management, right? So both for hand pumps and for pipe water systems. When you look at these different categories, I imagine each of you is going to get an idea of different stories that pop up into your head of challenges that you may have. We've already talked about capital finance with Large, right? Getting all the funds that you need from grants of the government is a challenge. That's always going to limit you to a growth trajectory and not a scale trajectory without being able to use loans. O&M finance was talked about with Mickey, right? That's only going to increase as time goes on. And oftentimes those pricing set points are just for operating costs and not those life cycle costs that Lars was discussing. Payment collection. A lot of these innovations are around actually getting that money from the customer. and the priorities that are surrounding that. It costs more to chase it sometimes than it is to get that non-revenue water. And all this is centered around incentives, right? A lot of the incentives we're driven by are from the donors or the governments we're working with, not necessarily what the customers are interested in. Not to mention, if you're gonna chase financial records for a whole bunch of different communities, the reliability of that or the existence of that is very minimal, right? And even using that for decision making or looking into the details, it's difficult. Deferred maintenance is often always deferred, never spent. And corruption is intermingled within all of these different spaces, right? So we've had experiences in all these spaces. I had a number of different examples to go through. I only had 5 minutes. So I decided I would focus on one in particular and show how that touches on a number of these. If you're in my presentation on Tuesday, we talked about leveraging loans to scale household connections. So Water Forward took about $260,000 in loans under a number of different terms, all of them below 10% interest, no longer than 7 years. One had a grace period, one allowed for some seasonal repayment. One we're going to talk about today had some currency devaluation protection. And when we look at this second one in particular, here are the results of what we're projecting this to go out after about 2.5 years of going through this. It's only going to pay back about 56% of that loan. And for us, that's not satisfactory. If you're looking at this graph, green is what we see us actually being able to collect in CDs for Ghana. The orange there is what we're supposed to be paying back. But then that blue is even a different factor where that currency devaluation based off of that exchange rate over time, that's actually a loss to the financier. And so that's something that we have to account for that we're probably not going to be able to get in all circumstances. Right. So all of this goes into what we would say is a failure, is something that's not good enough for us. Some of the information that goes behind this is the seasonal data that supports these projections. You can see the dips, the ebbs and flows with the dry and the rainy season. And then you can see a mix of different customers. There's some customers that will get their buddy from the city to buy them the household connection, but then not use it consistently, right? They're the duds over here on the left. But then on the right, you have some really high-end productive users. These are great circumstances where people are using it for the restaurants or to build bricks or even on-selling to neighbors. And you get a mix of these, all of which actually still increase the regular consumption from a public tap. We're seeing 4 to 10 times depending on the market that you're working in. When you take all this together, what this loan creates is an impact on all of these different challenges that we have. First off, if we can get it to a point where we can finance a good chunk of this, obviously you're pulling in some extra money into the wash sector, yes, but there's a little bit more to it than that. There's an incentive for us to figure out how to lower our costs. When we went back and looked and took out some of the bells and whistles and the tank tower that went associated with it, we could cut those those household connections in half, right? That's a benefit to us. We're pushed to get more efficient, right? If you're always using grants, that pressure is not always going to be there, right? And when you do that, now you can build a whole bunch more household connections with that same initial investment. Your revenue increases 76%. You're making more of a dent towards your O&M, right? All this together, whereas before they weren't even paying off themselves, so to speak, now they're paying into the full system, right? And we're looking at a projection of about 11% internal rate of return for 25% of the entire system, covering their own costs, but also pushing into the treatment works and the pipeline and everything. So with all this in mind, there's plenty more discussions that I could talk about in this space. I think the rest of us have contributed greatly, but I will go ahead and pass it off to Karen and then come back and talk about water safety management in just a second. Thanks, guys.
Hi, everyone. Thanks for coming and joining us on Friday. My name is Karen Setti. I am actually presenting on behalf of some colleagues who have been doing a lot more hands-on work with this, Bashir Yachori and Peace Musang. So thanks to them in advance for their help with the slides and everything. The problem statement behind the Water Quality Assurance Fund, and apologies if you've heard about this on Monday and Wednesday. I know we're talking about it a lot. It's getting a lot of interest. And it's something that we've gotten a lot of funding to scale up. So the basic problem when it got started was that no water quality data was really available in this district in Ghana that we're working in. And this is, I think, for context, one of the districts where a lot more donor funds and development work has gone into. So it's really almost a best case scenario. But still, there were not a lot of there weren't any testing activities going on, and a lot of these systems had fecal contamination. So there was a pretty big risk to the consumers. So what we came up with was the idea that rather than trying to do testing on site or set up laboratories in each of these rural communities in the district, that we might be able to centralize monitoring activities in a professional laboratory that had the capacity. And in order to incentivize the laboratory to participate in that, the different rural communities pay a subscription, but we also have donor funds that are leveraged to kind of backstop that. So if the community doesn't pay, the laboratory still gets paid. And so they see this as a new form of revenue, a new line of business that they can embark on. And then with the data, it's also very important to make sure that once the testing happens, the information gets communicated back to the community and to decision makers so they understand that, hey, your water system was contaminated, what can we do about it? So this is a little bit more of a detailed infographic on how it works. I know I'm going through this pretty quickly, but over here on the far left, if I can point with it. There we go. On the far left, we have the laboratory doing the monthly testing, and we have the water systems, each of them paying a monthly fee. And so their fee is maybe not as high as it would be if they were the only ones paying for this, but the fact that we're sharing gas, we're sharing lab assistants, we're sharing a facility, we're sharing vehicles, makes it a lot less expensive to go and collect samples from multiple locations. And so here in the next box here, it shows that they usually will pay the monthly testing fee, but if they don't pay, it goes back to a legal agreement that we've set up that the assurance fund will cover the cost of testing. And then the idea is that in the long term, the water systems that might have defaulted, that might not have been able to pay on time, would then repay that money back into the assurance fund and replenish it with a fine on top of that so that the fund is sustainable. So that's the idea. The impact we found has been pretty great. There are 59,000 people who have been served now that are now having their water quality monitored that weren't having it monitored before. The idea in the district has caught on, so we're being asked to do this, replicate this in other districts. We're looking at also scaling it up in other countries. And then in particular, there were 2 water systems where they were hearing that their water quality wasn't so great, and they asked Aquia to come in and help figure out what's going on with our chlorination. Why is the dosing maybe not working? And they actually saw an increase from about 25% compliance with adequate chlorination levels before to about 97% after. So pretty big improvement for a lot of people. And with that, as I mentioned, we're thinking about scaling this up in other places. It seems like a very successful pilot, but of course we know that in our field, this happens a lot, that interventions look very promising at first. And so there are definitely challenges. One of them is implementation support. So I mentioned our colleagues that are working on this are doing things daily to kind of troubleshoot, contact people, talk to communities, figure out if communication gaps if things fall through. So that level of kind of knowing how to troubleshoot and knowing how to work through those things is something that's very important to making this run and making it run well. Also defining what is a sustainable drawdown. So I mentioned that in the ideal scenario, the fund gets replenished, people pay back if they miss their payments, but we're realizing that that's not always necessarily the case. For example, during COVID, maybe people weren't able to pay, or if you were to have 2 bad years in a row with your harvest, maybe there would be financial problems, other things happen. So we want to be able to define how good of a deal is this? How much are we saving over what it would otherwise cost? And so that's really important, I think, because with donor funds, rather than just paying for monitoring directly, you're leveraging the money and making it go a lot further. So we need to define what's the expectation there. Scale up, sorry, the image got moved over, but yeah, so scale up, there are definitely challenges working in other places that maybe haven't had as much work done previously. Trying to move into other country contexts. I think what we're doing now is kind of screening communities to see if we think it's viable, that it would work well there. But there are definitely always challenges when you bring in other contextual factors. And then the final thing is an exit plan. So right now, Acquia is doing a lot of the work in setting up the agreements and making sure the implementation support is there, going back and checking on things. But ideally, this would be something that would be an agreement between the lab and the district assembly of the communities in the long term. And so we would then need to kind of extract ourselves without messing up the system. So I think I am turning it over back to Philip.
You're awesome. Let's see. All right. I'm back, and this time we're going to be switching gears from pipe systems and finances to hand pumps and water quality. We know that plenty of people are still relying on hand pumps at this point in time, right? 200 million people. And we know they're improved sources. That doesn't mean they're necessarily safe. There's a study done by Kirsten Danner just this year that was looking at a pretty big sample size of hand pumps in Ethiopia. And only 16% actually tested clean for E. coli, right? When you have that situation and you're promoting this as a good source and you're trying to have a company image of providing clean water, this is a difficult situation to grapple with. You know, how are you promoting this? And so for us, we wanted to try to look at what are some of the solutions that are available to actually treat that where we're concerned about it, and then what interest does that generate from the customer. So what we came up with is the NuPump, in line with our NUMA piped water services, where it's an inline hand pump chlorinator. It's erosion based. It's got a small sediment filter in there to catch anything that may go through. It's about $900 to $1,000 per unit. And what it kind of just fell right in line with our monthly maintenance program, where we would be visiting these sites anyways, and you can refill the cartridge each time that you're visiting. And when we looked at this particular product, we wanted to give it a real good evaluation. So we partnered with Acquia and had them look at this product over a 9-month period. They went and communicated with, we piloted it in about 10 communities, and they communicated with about 660 different households to really get their view, both in a control group and an experiment group. What is their willingness to pay for this? What's their experience with it? And we evaluated it from these 3 criteria: water quality, customer experience, and financial viability. When we looked at the water quality, it's actually, we felt to be best in class. There was 94% of the samples that had no E. coli and a very consistent dosage with about 0.6 milligrams per liter on average at the hand pump itself. And I think about 0.28 milligrams per liter when you actually went to the household even. The challenge is that's a pretty substantial upfront cost. Other competitors that are out there are down in the $50 to $150 range, right? So it's a higher tier up. So can you get enough money back from that it's going to be worth it? Well, there's an increase of willingness to pay from about 4.5 CDs to about 6.5 CDs in Ghana. And that's enough to cover that chlorine cost. That's enough for those minor repairs, but not enough to really pay back that high upfront cost. So downside on that, right? When we're looking at the customer experience, those customers are not necessarily looking for that chlorine taste, right? So when we got some feedback from them, that's something they're not used to. That's something that, especially when you have iron in the water, can create a negative taste. So there's some negative experience there. And then there's a little bit of back pressure. So it may be minor, but there's some feedback of, I'm having to put a little bit more work into this. So there's some negatives on that side. And on the flip side, they had this expectation from all of other systems in this area. Oh, this is NUMA. This is gonna fix all of our problems. It's gonna taste really good. So there's also a higher expectation and not fully meeting those expectations, right? So it's working technically, but unless you've got this buy-in, unless you have this good customer experience, you're not really pushing into a space where it's going to solve that problem and it's going to promote the usage that you need. So for us, this isn't something that we want to push heavily into, right? It's not solving all those problems that we have. So we're actually looking to make it open source and available. It's really not a complicated design, and let people continue to iterate with it, see if they can get it down to, you know, $250, $300 price point that starts to become more reasonable, and just see what happens. We never know, you know, with all of the brilliant minds in this room, what different ideas can come out of it. In the meantime, we'll continue to innovate and see in what ways we can solve these different aspects. With that, I think that closes the rest of our presentations, and we'll transition to a Q&A session. Thanks, everybody.
I think all presenters can actually come to the front because we're going to receive questions, and Rachel Pellets will moderate.
Thanks, everybody, and thanks for some really great presentations. So I'm going to open it up for Q&A. I, of course, have some of my own, but the mic is there, so don't be shy if you have questions for any of these great presenters. Maybe, since I don't see anybody moving immediately, maybe I'll start us off with a question for Lars. About kind of what's next for the district-wide planning. And I know you had mentioned, you know, a few challenges in terms of high turnover of staff, low institutional capacity, integration with regional government, sometimes money being going to other districts. So I'm curious if you see, you know, what you see as some opportunities to mitigate some of these challenges. Yeah, I mean, yeah, please.
Yeah, thanks a lot for these good questions. And just different activities, how we try to resolve the challenges. On the capacity side, I think I want to mention the WASH Systems Academy of IRC, which summarizes a lot of the learnings, the system strengthening approach and others to create capacity. It's freely available and now translated, for instance, into Amharic to make it more accessible. In rural areas, of course, that's a challenge still to access. So we made quite some good experience with blended learning sessions, like having WASH professionals being in one room, taking the course online, and then having reflection sessions in between. So just an example of how we can address and try to address the capacity gap. On the revenue, I mean, probably the 3 districts in Amhara are some of the more challenging ones at the moment. Like in other districts, other countries, I think have more promising results about getting additional finance. But yeah, the idea at the end is we would want to make projects ideally even bankable, that like in the US, I assume everyone wants to invest into water utilities, yeah, because there is demand, there is money coming in for sure. If we can get projects there that we not only rely on government funding and money coming from donors, that would be, and the goal, how we can really move into scaling water supply also in rural areas. It's tricky, and I know there are many people here who probably challenge that on how far we are, but I mean, good financing models, attracting private finance on top of government and donor finance is the way to go.
Great, thanks, Lars. If you don't mind, I see there's a question in the audience. If you don't mind going to the mic, because we are, I believe we're still being recorded and have virtual capabilities.
Brian Jensen, a data management consultant. So this question is for Lars. Lars, in your district-wide costed planning, how specific did you go into the different schemes that would be invested into? And how, for the investment that did come in, that 20 to 25%, how much of that actually aligned with the costed plan? Is it based on, you know, what came in and then how much of it was actually invested in those line items?
Thanks for the question. I'm afraid I can't answer it right now, right here, because I've directly been involved into the project in those three already, but very happy to link you with colleague Macho, who is working there, who could give much more information about that. But generally, the plan should really be relatively specific on, like, when you look at the district, see what is there, like which areas you want to reach with a piped system, like probably around the urban center, while some more remote areas you may still want to go for point water sources. But that, I mean, that depends also on the stakeholders in the districts on what service levels by when they would want to achieve. But to have a goal, to have a strategy, a vision of where to go, and then be strategic to reach that.
Great. Thanks, Lars. Jennifer?
Thanks, Rachel. Thanks, everyone. Really great presentations, and it's really exciting to see all the work being done. So my name is Jennifer DeFrance. I'm with WHO, and I had a few questions for Karen about the Water Quality Assurance Fund. So firstly, apologies if I missed it. What were the parameters being tested in the lab? And then I had a question just regarding the mechanism. Well, one, just like, so I understand it's funded through subscriptions from the communities plus from donor funds. And I'm just curious to know what percentage of funds from communities and what portion of the communities did finance from, or did the payments. Then also just a little bit about the engagement with the community to incentivize them to pay. If you could talk about that too.
Thanks. Yeah, I can give some partial answers and then I think Caroline will be able to fill in the blanks. So I believe it's just microbial testing for E. coli and fecal coliform. They also test, the lab tests for physical chemical parameters, turbidity, electroconductivity, pH. But yeah, we set that up for microbial, so E. coli. On the financial performance, so over the 2-year pilot, water systems were able to pay for 85% of the testing fees, and 15% of the time, approximately, the assurance fund had to pay on their behalf. This was a greater problem during COVID than it is now. Normally, when the assurance fund pays on their behalf, they're supposed to repay, but that repayment has only taken place a third of the time. So that's why Karen mentioned it's a drawdown fund, because we don't expect 100% repayment. Community engagement, so there's 2 levels. There is managers of the water system. We engage them at the onset, and they actually sign a written agreement with their district authorities where they commit to monthly payments. But then we found along the way that we needed to go beyond the water system managers and really engage communities as well, because they see people in lab coats come and take samples every month and they're like, what's going on? So we are now revised our protocol to do a community meeting at the onset, but also regular radio announcements. So these places in Ghana actually have a very vibrant local radio. Each community has a community center with a speaker, basically. And so we use that for talking about water quality or sharing results. Yeah.
Thanks, Caroline. Great to hear how radio has been a part of engaging the community. Thanks. Next question.
Yeah, thank you all very much for your talks. This is really inspiring and great work. I had 2 questions. I hope you don't mind. The first is for Mickey. You mentioned this issue of like why pay if it's working, and this is something that comes up a lot in health insurance schemes. So there may be some lessons there. But one idea that I had, and I wanted to hear what you thought is actually maybe like sort of joining up with a monthly chlorination supply could help, because there's something very tangible and kind of like a stamp or a taste signal that you're actually providing something month to month?
Yeah, thank you so much for that. So we actually did do a small pilot with Aquia to test an inline chlorinator. Unfortunately, the chlorinator that we did use didn't have enough chlorine in it for household, so it was still unsafe at household consumption. Of the 10 communities that had chlorine, 2 did drop out because they did not like the taste. But that's definitely something we're looking into. It didn't look like it had any impact on payment, just because I think the main thing we were looking at was, does it make it safe for household use? And we did have then our hand pump mechanics did deliver the chlorine tablets with their preventative maintenance.
And then my second question was for Caroline. I was just hoping you could say a bit more about the sort of the free rider problem, where like the VSLA members are paying for everybody else's water. And I was curious if you thought there might be a role for kind of social recognition or social motivation. We had some like pretty modest, but noticeable success with that on latrine use in Bangladesh, and so might be helpful.
Yeah, that's a great suggestion. So so far what we've done is talk to the free riders to understand why they were not joining. And basically they said they're already part of other village savings groups and they don't really need another one to save and take loans. So but in theory, they say that when the time comes to pay for hand pump maintenance, they will pitch in. But yeah, the users are a little concerned that the VSLA members don't really believe that. So I would say for now, we've mostly diagnosed the problem. We haven't fully really understood how to address it. Yeah, so I would be really happy to hear about your suggestions about social recognition.
Thanks. Yeah, thanks for bringing up a good point about the free riders that are getting the maintenance without paying. So thanks. I think.
Can I jump in on
Yeah,
that?
yeah, thanks.
So one thing we didn't get to talk about, but one of our other partners, to their credit, Uganda Water Project had something associated with that, where they actually, logically went through it and said, we're making these agreements with the water committee. They're not the ones that are actually having to contribute to all that. So the real accountability comes from individuals. So let's actually get a document of all the households that are listed, put in that extra work up front, and then get their numbers so they can do text reminders periodically. So when they're coming, it's kind of I am talking to you rather than the group, right? And that's shown actual results to help. So I think that speaks to it.
Thanks, Philip, for that idea too. I think we'll just take the 3 people that are standing here, these 3 questions, and then we'll move on to the next activity. Thanks.
Thank you so much for the talks. My name is Camille Zimmer, and I'm from the University of Victoria in Canada. There's been quite a bit of, a few people have mentioned community engagement, and it's been quite a topic, building local partnerships throughout the week. I was wondering, all of you have mentioned many challenges that you are facing for your various programs. Just wondering what kind of solutions you've come up with, or that the community has come up with. Has there been any successful examples of engaging communities to address these challenges? Because oftentimes they know better than probably anyone what their challenges are and what they need. Yeah.
So I guess whoever wants to take that one on engagement.
I mean, I can talk briefly just about our piloting of the drip irrigation system. And those 4 communities are very excited to be able to work and make extra money to then pay for it rather than, pay it out of their pocket. This is the first dry season. The dry season's just ending. So this is the first dry season we piloted this. So it's still very, very new, but from the onset, it looks like I received a picture a couple days ago of all the onions that have been harvested. So right now it looks promising, but time will tell. For payments and stuff, you know, some people in the community want to pay, some people don't. So then, you know, they usually drop out. So that's not something that we've been able to directly figure out.
Yeah, I'll just jump in. So I've actually spent some more time with Mickey's data than some of the Water Quality Assurance Fund data, but we're looking at kind of community perspectives from interviews and focus groups, and I'm actually looking for themes of trust and fairness because those play in a lot to our decision making. And one of the kind of bigger trends I think I've noticed a little bit from the conference is we tend to kind of other groups where we assume that maybe their preferences or their ideas are very different from ours, when in fact, all of our brains really are wired the same way. We all want to be treated fairly. We all want to be able to trust that what we're doing is going to work well and benefit us in the long term. So there are a lot of distinctions between what people see as fair and unfair. So, you know, if I see that my neighbors are paying or not paying and I am paying for water, that demotivates me to pay. So there's actually some things about like community size and whether the payment is the best fit for the community. So we're talking about things like maybe moving to a per household payment rather than a payment that's a fixed size for any different size of community. And so there are things like that, the ability to, you know, if we don't like the caretaker, if the caretaker is using very harsh enforcement mechanisms, that there's the power or the autonomy to remove that person so that, you know, you don't have to deal with kind of these harsh enforcement tactics. So yeah, a lot of it comes down to really just wanting to be treated fairly, to be able to trust the process. And also, I think professionalization came up in an earlier session, be paid for your work, not be expected to work voluntarily and not receiving benefits from that.
Thanks, Karen. It's a reminder of some of the common principles that go across all of humanity that we should, you know, bring back to our work. So thanks.
Hi, I'm Sylvia from UNC Chapel Hill. Firstly, I want to say how great all of you and brave, like really try to tackle the problems that even in the literature, the data about the success is not that high, because market-based approach firstly is not mostly successful in developed countries, but it's not many like evidence its success in developing countries, and you are really using like so many innovation. And I just want to say like I really appreciate that, because based on my own work experience that in the community, it's not easy. So many challenges every day you will be facing. You have this plan A and sometimes you have to B, C, and even Z, sometimes they just don't work. And I listen from you, I kind of like make this a conclusion, and correct me if I'm wrong. It seems like you kind of like integrate WASP with like irrigation, agriculture, and community like saving. And what I see maybe in the future moving forward, we couldn't really have WASP by itself. And I really like the idea to meet community where they are, because sometimes when we over only WASP, we couldn't really meet what they need, and we have to integrate with other things. And yeah, so that's what I get from your innovation. That's the first comment and the first question, if you see that like the direction that might be useful in the future. And the next question is related to the district strategy. I also work to advocate that, like support districts in my province before I become student. And even like the process itself already co-creating from the district government, we have provincial government and consulted in national government, because this program in Indonesia is supported by, the money is supported by national government. Usually the one who fund the document is only the national government. There is no buy-in, even the process is already co-creation. And I'm like, what should we do better? Like, this is really good document, that's everybody involved, but it's not integrated in their like daily planning and budget activities. And hopefully I'm allowed to have third questions. Like, for the third question is related to capacity building. Like, I face this all the time when I was working in Indonesia. Sometimes it's really depend on the political situation. because in Indonesia, we have new mayor, then the mayor will move people around based on whoever vote for him. It's really volatile like that. And also sometimes you will get people who have no understanding about WASP at all in the position. And I worked for non-government organization before. We already trained these people. And there is change sometimes in mid-year when we are right about to implement our program. And we we don't have the money anymore to train them. And even we train them, there is no guarantee they will stay, or there is no guarantee that people care about the sector like we care. So the challenge is quite big there, and it's still happening all the time. One idea I learned from other discussion is about investing in learning culture in the organization. So like you say, there is available online learning, but sometimes if it's not part of the system in that local government, it's really difficult for them to want to learn, because in my case, from my experience, there is no incentive to understand more. So it's, yeah, if you have ideas, how can we do better moving forward? Thank you.
Great, thanks. A lot within that question. Maybe I'll just ask one person to respond because I know we're kind of out of time. I know there was themes on market-based approaches about districts relating to national plans and capacity building. So
Yeah, so I can just respond very quickly to the first question. There are definitely underlying social determinants, poverty in these areas, and people are, if you ask them, can you pay more for water? The question is, can you give me something so that I have economic development so that I can pay more for water?
Yeah.
AKA, what am I getting out of it?
Yeah, I think we'll maybe just move on to the last question, or you really want to speak. Lars, you look so sad that I'm not letting you speak. So, okay, 1 minute.
Then during the coffee, I guess important is the institutionalization of the approach. It's just at the moment we work in Ethiopia in 6 districts out of almost 900. But we have the national government on board and discussions at national level to kind of demonstrate with our focus districts that there could be a way, an interesting approach to go and to strengthen. And we try always to include action research, like to have some budget and capacity available if a question comes up at district level, that together with the stakeholders, we can work on that and hopefully find some answers and ways to proceed.
Yeah, great. Thanks, Lars. Okay, Angela.
Thanks for the great presentations. This is a terrific session. I'm really enjoying it. I'm Angela. I work with WHO, and we do a lot of work on water safety planning. So beyond looking at operations and functionality of rural water supplies or even water quality, looking at risk factors and how well they're managed, so in these cases, are there latrines nearby or animal access to these wells, or sort of drainage that could be allowing water to pool in the area and infiltrate the supply. And a lot of our work on this has been focused on kind of building that capacity at the level of the water supply. So working with those water user groups, and with mixed success, because a lot of times these water user groups really aren't very active. And so expecting them to do the water safety planning hasn't been successful. So I'm just curious about your thoughts on the scope for integrating this into what's expected of these professionalized service providers that are servicing different systems. So beyond their work to look at the functionality and do the preventive maintenance, would it be feasible for them to do something as simple as a sanitary inspection when they do their 6 monthly or annually visits? So is there scope for that? Is that a model we should be looking at for who can take responsibility for this proactive risk management? Thanks.
Thanks, Angela. Who wants to answer about risk management?
And from our side, absolutely. Water safety planning should and is ideally part of a district master plan.
I think from our side, I think we do basic checks of, is the fence there? Are there those safety measures? We don't do testing right now. I think that's definitely something that can be integrated fairly easily, because if they're going to a location anyway, and they have to make sure the water's working, then they can take a quick sample. We don't do that right now. And I think some of it is because we're now trying to tackle the financial viability. If it's not financially viable right now, then adding more tests isn't gonna, help us get there.
And I would say, it can change too. For us, we have it built into our operations. Every time they're visiting, they're checking certain things like that. But we had one site where somebody added a latrine just up the hill after we put it in, and it was like, fortunately, we had treatment on that system, so we could deal with it. But the idea is like, you have to build into your, for us, business, that professionalized mindset that's really being pushed. Those aspects continuously. It's not a one-time thing. It's all growing and changing, right?
I just wanted to comment on the water safety plans. So actually, as part of the Assurance Fund program that we have, we've seen water quality data be a great entry point to talk about water safety in general. So rather than coming in and say, let's do the water safety plan training, which might be a little bit ambitious or intimidating, we just, start with providing them with monthly water quality data. And it's been very transformative. Over time, we've seen water system managers that had never heard of E. coli before, understanding that there was fecal matter in the water, wanting to treat. And actually 2 weeks ago, they managed to convince authorities to raise tariffs to pay for the treatment and the testing. But that didn't start with the water safety plan. It started with just data and helping them understand it. And I think as you go in the transformation, now we could talk about more holistic risk management.
Thanks, Caroline. Thanks for bringing up one of the other SDG accelerators to data and information, in addition to innovation, that can really make change happen. So now I know we had planned to do an audience quiz. I'm going to pass it over to Karen. I do know that we are really behind on time. So yeah, maybe just a round of applause for our panel. Thank you so much. But thanks all for great questions, and we'll have some opportunities to continue discussing.
Yeah, so if you all don't mind pulling out a mobile device or a laptop and punching in this URL. Sorry, we couldn't get a QR code. It wasn't in the budget for this platform, but. When you get in there, you'll see 3 questions, but I'll leave this up just so you can make sure everybody gets it typed in. Probably not. There is a /R after the .com, just in case anybody missed that. Has anybody gotten in? Yeah, okay. Anyone need more time to type? Working your fingers out this morning. All right, I'm going to go ahead and look at the we'll switch to the question view. We're ready. So we wanted to talk about not only innovation, but the failure aspect of innovation, the fact that, often things don't work on the first try and you need to modify. And we really wanted to get you all involved because some of these questions are not necessarily clear cut. There can be multiple pathways that seem reasonable at the time. Maybe in retrospect, you would have done something differently. But yeah, these are the kind of challenges I think we all face, and we wanted to use this session a little bit to kind of commiserate and talk through that. So let's see. Oops. Okay, so the first question is, after receiving a formal kiosk displaying the local government's logo, WaterPoint caretakers in rural Ghana saw the revenue increase by 50% on average. However, 3 years later, 19 of the 30 kiosks have closed down. How should you address requests from implementing partners in the district to scale up this intervention? Option A, give them all of your implementation materials and encourage them to scale up your intervention. Option B, recommend that they don't pursue their plan since the intervention may fail 2/3 of the time. Option C, examine the pilot experience in more depth to understand if the intervention should be tweaked or targeted towards specific sites that are likelier to be successful. And option D is engage local community volunteers to reopen the kiosks. So I'll let you all answer. And then at the end, you can submit your results after you've answered all three. Question 2, the scenario is you are testing inline chlorinators on hand pumps to increase water quality at the point of consumption. You assign some community boreholes to receive the treatment and some as the control with no chlorinator. At the midterm of the study, you note the household water quality for those collecting water from the treatment boreholes is the same as the control group. What do you do next? Option A, continue and complete the study as planned. Option B, stop the study, but investigate further why the water quality might not have improved. Option C, work with the intervention communities to also treat their water at the household level while completing the study. Or option D, temporarily hire an engineer to inspect the chlorinators each week. So you can go ahead and add your answer. And then the last question is, you invested a lot of time in piloting and evaluating a new intervention. Unfortunately, your preliminary results show the intervention did not achieve the outcomes you were hoping for. What should you do next? A, hire a consultant to reanalyze the data. B, report on the aspects of the intervention that were successful and keep working internally on improving the aspects that were not successful. C, request more funding to pilot the intervention in a different area with a different population. Or D, report on all of the outcomes, analyzing what might have gone wrong during the implementation process and what strategies could be used in the next iteration. So once you've clicked an answer for all three of those, go ahead and hit done. And you should be able to see the results on your end while they're up here. So we can talk through these questions. It looks like on question A, this was about the kiosks that had not all kept working. The most popular answer was to examine the pilot experience in more depth to understand if it should be tweaked or targeted towards different sites. Does anybody want to reveal the correct answer? Okay, we were going with that as the most correct answer. None of these are necessarily incorrect. They all might be correct in different circumstances, but in this situation, it might make sense before you tell somebody else to do more with it or do less with it to try to understand what other factors might have gone into the lack of sustainability. All right, for question 2, we have a great split here across the audience. So this was about the inline chlorinators. And again, we have a very smart audience in the room. I think this is the option that we were considering the most correct. Again, context kind of plays into these decisions, but this was actually our experience. We did end up stopping the treatment arm. So you wouldn't want to necessarily interfere by having the treatment done at the household level. And you also wouldn't want to continue the study if you knew partway through that it wasn't, your treatment group actually wasn't getting the treatment. All right, and then the last one, looks like most people picked the third option. Again, great job, you all are awake today. So yeah, the more correct option here would be to report on all of the outcomes, both the ones that you felt were successful and the ones that you felt were not necessarily demonstrating success, so that other people might be able to learn from that experience and do it better the next time. So thank you all for your participation.
So because I took way too long moderating the panel, we're going to change things a little bit. We initially had planned to do breakout groups discussing about failure and learning from failure. And since it's a relatively small group, I think we will just have more of an open discussion because we only have 15 minutes left for this session and we recognize how long it takes to get into groups and things. But so I'd love to just kind of open up the floor and maybe actually I'm going to ask someone from our panel to maybe, and it's up to you who wants to volunteer here. I see we're all sitting right here. But maybe I'll just ask somebody to kind of kick it off and talk about learning from failure, or maybe some of the experiences of things that haven't gone quite as we planned and how, how we can learn from that. And then also if there's other questions about that. So it looks like we already have some ideas on that one. And just as a reminder, I mean, this is part of innovating, right? If we just did business as usual, we would get the results as usual, right? So, to try new things, sometimes we're not going to get what we expect, and that's okay. I think what's important is that we're learning from it, we're iterating, and we're working to improve. So thanks. I'll pass it to Philip.
I actually jumped up because I wanted to do the Alcoholics Anonymous. Hi, I'm Philip. Thank you. That's what I was looking for. No, one that I didn't talk about, but is on the pipe system side for water quality was I was out with our Uganda team, just running through their procedures, how they were doing their different checks and everything. And I noticed that they were doing their free chlorine on those pipe systems a couple times, but they only had one slot in their questionnaire to enter a value. So they would always enter it after they had fixed it. So they're fixing it continuously, but we were missing that gap that on these particular systems, it took 2 or 3 tries to get there, right? So it took me being with them, it took me seeing that process to then get into it and say, all right, let's record each one of these. When we have those situations pop up, we need to flag that. And it's just a process to go there. So like I said, I kick it off and now you guys have to do the same and we'll say hi to you too.
Maybe, I'm going to pick on somebody if nobody actually volunteers. Okay, I'm gonna pick on Katie, if you don't mind, because we haven't heard from you. So I don't know if this is a danger of people I know, I'm gonna pick on them, but from Katie Sill from that works on the WPDX, the WaterPoint Data Exchange. Many of you know of, it's a great open source resource. So yeah, I would just love to hear, maybe if you don't mind standing up and using the mic, actually just kind of would love to hear, kind of where you started and where you are now and kind of that journey of iterating and building and how things have gone.
Sure. So hi, I'm Katie Sill. I'm with the WaterPoint Data Exchange, and we just launched the Wash and Healthcare Facility Data Exchange. We have a standard that we would love feedback on, so I think this might be a good group to request that input. It's exciting to actually see this panel and see the presentations today because we have data from almost everyone on the panel, so that was pretty cool. And I know the data is being used, I think, by others on the panel, so that's also exciting. WPDX was started in 2014 as this idea that lots of people have data and it's all on their own computer. And wouldn't it be nice if we could know and learn from other people? And so there was a standard developed and a platform, and we've taken now, 8 years to really iterate and improve on that platform. So if you've used the platform over the years, I'd love feedback on, it should be much easier now to share data. Someone told me once in the early days, it was like going into the depths of the internet. Like you had to be very skilled to share data. And that's hard. It's hard to take that time when you're a busy person and you're already trying to do, 3 or 4 jobs these days. We've also been working a lot on the tools. So trying to make decision support tools. We have tools for admin coverage, estimating on WaterPoints. This is all WaterPoint data, so it's not household connections, it's not municipal scale. Looking also at repair, rehab priority, looking at new construction, looking at preventative maintenance. So Mickey, I want to follow up with you on your model because I was very interested to hear, how you're approaching that question. One of the biggest challenges is getting data. So for us, I think it was if we build it, they will come, and then my mentality has been like, if we make it better, they will come. And it's still a bit of an arm wrestling match to say, hey, would you like to share data? Some folks are so open. I have to congratulate, I think, Bill and Water 4 as being so open with your data, so willing to kind of partner and brainstorm. Other organizations are similar, but to try and get that data at scale is challenging. We've been working with MWA and IRC in the areas in Amhara, and we have amazing data there because we have all the Laredo data and all the NGO data. And it begins to show what's possible when you really get the information together. But it's a challenge that I would love input on. How do we make sector data sharing a standard? How do we say, hey, we all know we need this information. So let's just do it, because I'm asked all the time, hey, do you have data for X? And I say, do you? Because we'd love to host it, but I don't collect data. We just host it. So I feel like this is like a talk therapy session now. I'll pause there.
Yeah, thanks. Thanks, Katie. Yeah, great to hear from you. And also, yeah, be thinking about how we can do more with data sharing in our sector. And that can also help us learn from failure and from things that don't go as planned as well, too. Kind of have a quiet group here. Anyone else want to either add to that or build on that? Thanks, Caroline.
I just wanted to make a comment on reporting bias. And this is something, we're researchers at Acquia, so we face that challenge often. The examples you saw in the quiz, the kiosks not quite working, the inline chlorination not bringing results, those are things that happened to Acquia over the past couple of years. And it's really tempting not to report failure, to let it, to push it under the rug and say, oh, this didn't work, let's not talk about it, or we'll write a very minimal brief and it will be hidden on our website. We're not going to go out of our way and do a webinar about this or write a peer-reviewed publication. We have this bias, like the kiosk thing is not a paper, it's a brief. We didn't present on it today, right? We presented on the things that work, the assurance fund, the village savings groups. So we wanted to acknowledge that we all have this reporting bias, but the failures are almost as important as the successes. I feel that the village savings groups example is an alternative to a model that was there before and that was failing, which is called pay as you fetch. It's been going on for 20 years. Nobody is reporting that it doesn't work. It's only until recently that a survey showed that, oh, it's not working, but people working there knew it didn't work, but it was kind of quiet and it wasn't front and center. So I'm standing here just because we're in therapy mode, and I want to challenge myself to not have that reporting bias, to really share about failures, because that's equally important to successes. If anyone wants to kind of talk about a failure that they haven't talked about before, they can come up here.
Thanks, Caroline. Or also other, opportunities to iterate and kind of build upon what we've already learned. I'm gonna just call on somebody if we don't have any volunteers. I'm feel like I'm back in teacher. Oh, we do teacher mode. Thanks. Yeah, do you mind? Sorry, just because I think we do have an online. Oh, I'm getting some online questions actually even. So no, go ahead, please come up.
So I was wondering about the potential to do this in maybe not a totally anonymous way, but at least a little bit of a private way. Sure. Just because, like an established institution with a large track record and everything can, sort of open up the closet and everything. And, and that's great, but sort of a smaller, maybe more innovative institution without the track record, I think would be very averse to doing that. So if there's a way to, sort of actively go out and collect this in sort of a safe way, therapy mode, a safe way for people to reveal information. We had sort of a moment like this in the RCT world where Dean Carlin of IPA was writing everybody, hey, tell us about the dumbest thing you ever did. And of course, the luminaries of the RCT world were very happy to nobly share everything. And then people like me were not, a little bit quieter, even though we make, many more and worse mistakes. So,
Thanks. No, Thanks so much. That's a really good point that, we have to think about confidentiality and reputational risk. And so sometimes, having these channels for communication that aren't necessarily public initially are also something that we should be thinking about as well. So I see online we're getting a few comments about the wash failures. And also that data sharing is important, but also translating the data into meaningful information as well. So I think that's kind of goes back to what Katie was talking about, that we, it's not only about raw data, but about what does that look like? What form is that in? How is that communicated? And making sure that that's, accessible to people. I'm just trying to scan these other questions. We have a comment here too about community involvement in water safety planning. Even if services are professionalized, a community managed water safety plan is a powerful way. And users and communities can work together. So thank you to the online audience for that comment. I know we only have a few minutes left, so I think I will then now pass it over to Carly from the Hilton Foundation to do our closing. So thank you all. It's been great to be part of this session.
So first, I just want to start by saying thank you to everybody that shared, because this is tough, right? It's not easy to look at yourself and pick apart the things that keep you up at night because you're just thinking, oh, I had that missed opportunity. And as folks were talking, I was just reflecting on the pressures to not share. And that in many cases starts with the donors, right? Like that's where some of this dynamic comes from. And I feel really privileged, having just started with the foundation, to be working for an organization that cares about investing in research and investing in that learning. And I think I'm very privileged to be able to try and develop those relationships where we care about the failures. We all want to understand how we can fund differently, how we can fund you guys to act differently. And there is that inherent trust that must start with us to some extent of, can we build this relationship where we all feel comfortable sharing all the things we're uncomfortable with? So I just reflected on that very much as you guys were sharing, and it's something I'm striving to do. And if you guys have feedback for us on how we can do that better, I very much want to know. I was also asked to take this time to reflect on some of the pitfalls and lessons learned that I've had in terms of innovation. And I want to focus on one, because I'm sure we could be here for days talking about all of the failures and lessons learned. We all are here because we care. We care about these issues. We care about the people we're trying to serve. And we identify what the root causes are. We think we have a really interesting solution, and we feel that imperative to develop that solution as fast as we can, put it out there, understand why it's working and why it's not working, and report back to our donors as fast as humanly possible with the best possible results. It's really easy not to be inclusive in that process. And thinking about inclusion from inception to dissemination, all the way down to dissemination, it's really easy not to do it. But we have that ethical imperative. We have that ethical imperative from the beginning, not just to say, in our design, we had a focus group with some women. We didn't really think very closely about who those women were, what their experiences were, and how that was representing different groups within these communities or these stakeholder groups. Really understanding the part that we play in mitigating those obstacles to engagement. Are we bringing people to a second story floor for a focus group discussion because it's cheap and we didn't have to pay for the space and it was convenient and we knew the folks that owned it? Are we not engaging the right individuals because we're doing this at the wrong time and we're not thinking about time poverty in the way that we're talking to people at the beginning stage as well as the dissemination stage? And that costs money. It costs time. We have this imperative to go fast and be fast. And I would urge people, as you're talking to your donors, as you're talking to us, know what that cost is, know what that time is, and include that in what you're asking from us. It's not like it requires effort, time, and resources. And we should be beholden if we really think and we care about making solutions that are good for the most vulnerable of these communities. It's on us to be funding that. So please, it's a call to you guys to ask us for it and tell us what you need, because there are resources engaged in that process from beginning to end, but also to donors to be asking people to think about it, to share that we care about this, that we care about doing good work rather than fast work. So that's my little soapbox piece of lessons learned that I think we can move a bit farther. But thanks so much to everybody for joining us in this Friday last session and sticking with us throughout this whole process. And thank you very much.
No, I don't know. We planned it this way. Oh, yeah, I have. Yeah, we should have somebody. I've heard your name. That's my. Awesome. I appreciate it.